Hello and welcome to the Nutrition Diva podcast. This is Monica Reinagel, and this week we're going to take a look at a handful of non-prescription supplements that claim to reduce your cholesterol levels. Are any of these effective enough to perhaps replace prescription medications? Or could they possibly be used in combination with one another? But before we dig into all that, Nutrition Diva listener Ramsey asked me to clarify the difference between fermented and cultured foods. What exactly is the difference between them, and do they have the same benefits? Well, this is kind of a tricky answer, Ramsey, because cultured and fermented foods is a very broad category. It encompasses everything from yogurt to kimchi to beer, wine, and cheese. Cultured foods are a subcategory of fermented foods in which a culture of bacteria and or yeast is used to jumpstart that fermentation process and also to provide just a bit more control over which microbes are dominant. Yogurt, kefir, kombucha, and vinegar are all examples of fermented foods that are made by adding microbial cultures to fresh foods. Now, another option is wild fermentation, and that relies on microbes that are naturally present in or on the foods themselves, or even just floating around in the air. Sourdough, traditional sauerkraut, kimchi, and pickled vegetables are all examples of wild fermentation. If you've ever had a little dish of fruit salad or coleslaw get fizzy in the fridge when you kept it for too long, well, then you've experienced some wild fermentation in your own kitchen. Cheese is an especially confusing category. Some cheeses, like blue cheese and cheddar cheese, are cultured with various strains of bacteria and they're fermented, but others, such as ricotta or paneer cheese, are not fermented. They're simply curdled with some sort of acid. Cottage cheese is traditionally made by curdling and not culturing. However, some brands of cottage cheese now have probiotic bacteria added to them, and these are usually labeled as containing live and active cultures. It's really difficult to make blanket statements that apply to all fermented and cultured foods. Labeling conventions, such as whether or not they say live and active cultures, are somewhat inconsistent. And not all bacteria that are involved in fermentation are considered to be probiotic bacteria. That designation is reserved for bacteria that have been shown to have specific beneficial effects in the body. And then we also use that same term to talk about foods that contain those bacteria. And even for foods that are considered to be probiotic foods, the specific benefits are going to depend on the nutritional aspects of the food that is being fermented, as well as which yeasts and bacteria are involved in that fermentation. So, for example, yogurt is going to provide protein and calcium from the milk, in addition to probiotic bacteria. Fermented cabbage, on the other hand, will contain vitamin C, K, folate, and other nutrients that are found in the cabbage. And of course, some fermented foods also contain elements that we may be trying to limit in our diets, such as the alcohol in wine and beer, or the saturated fat in cheese, or the sodium in sauerkraut or kimchi. So if you're trying to maximize your gut health and your overall nutrition, my best advice is to try to incorporate a variety of different cultured and fermented foods into your diet, and just be mindful of any specific aspects, such as sodium or alcohol, that you may wish to limit. And now let's talk about cholesterol-lowering supplements. I recently got an email about this from Debbie, who wrote, "I consider myself very healthy and fit, but my cholesterol keeps going up every year, and it's now high enough that I can no longer ignore it." At 71, Debbie isn't on any prescription drugs. Go Debbie. And she really didn't want to start taking a cholesterol-lowering medication. So she started looking around online, and she found 3 nutritional supplements that all claimed to lower cholesterol. But each one of them featured a different active ingredient. One of them had cocoflavanols, another contained phytosterols, and a third was an extract from red yeast rice. Is there any research as to which of these is the most effective? Debbie asked me. Since they're all different ingredients, maybe I should take more than one. Red yeast rice extract is a traditional Chinese medicine. It's made by fermenting a certain variety of rice with a specific strain of yeast. And some studies indicate that its cholesterol-lowering effects are comparable to that of statin drugs. Those are the most commonly prescribed cholesterol-lowering medications. And there's a good reason for that. Red rice yeast extract contains a naturally occurring compound called monocolin K, which is chemically identical to a prescription cholesterol-lowering medication known as lovastatin. Unlike a prescription medication, however, the potency of red yeast rice extract supplements may vary, which obviously creates some concerns about dosing and safety. In fact, the FDA has attempted to block the sale of red yeast rice extracts in the US, but it hasn't entirely succeeded at removing them from the marketplace, especially the online marketplace. But look, if your goal is to stay off statin medications, then I think a red yeast rice extract isn't a very good solution because it's essentially the same thing. And if a statin drug does turn out to be necessary in your case, I really think you'd be better off with a prescription version of the drug because that's going to be better regulated in terms of its potency, better monitored in terms of possible adverse effects or side effects, and also more likely to be covered by your insurance. But what about those other two supplements? Cocovia Cardio Health is a heart health supplement that contains cocoflavanols. Now, you could get cocoflavanols from eating chocolate, of course, but you wouldn't get quite as concentrated a dose as you'd get from this supplement. And it's been put to the test in double-blind, placebo-controlled studies. The flavanol supplement was found to improve a number of aspects of cardiovascular health. Subjects taking the cocoflavanols had improved endothelial function. That's basically how well the blood vessels contract and relax, as well as modest reductions in their blood pressure and their cholesterol levels. Total cholesterol levels fell by about 5% on average, and that may not be enough to bring high cholesterol levels into a low-risk range. Which brings us to the phytosterol supplements, and these are sold under a variety of brand names. Phytosterols are compounds that are found in plants, and they're very similar in structure to cholesterol, which is found in animal foods. In fact, they are so similar that they can actually occupy the cellular receptors for cholesterol, thereby preventing it from being absorbed in the intestine. Studies have shown that phytosterol supplements can lower your LDL cholesterol, that's your quote-unquote bad cholesterol, by 8 to 10%. And for some people, this could allow them to control their cholesterol without medication. But here's an interesting thing. It can also be taken together with statin medications to improve their efficacy. Adding a phytosterol supplement can be comparable to doubling the dose of a statin medication. And unlike statins or red yeast rice extract, phytosterols do not have serious side effects or safety concerns. The effective dose of phytosterols for lowering cholesterol is 1,800 to 2,000 milligrams a day. And there doesn't appear to be any additional benefit to taking any more than that. In addition to nutritional supplements, phytosterols are also available in functional food products, such as butter replacements. Benecol is one popular brand of these. And you'd need to eat about 4 tablespoons a day to get that recommended dose. And that would obviously also add a few hundred calories to your diet. But of course, phytosterols are also available just in regular old foods. The primary sources of phytosterols in the typical diet are nuts, seeds, soybeans, and other legumes, avocados, as well as nut, seed, and olive oils. And the typical intake of dietary phytosterols is estimated to vary from 150 to 450 milligrams per day. Vegetarians and vegans tend to be at the upper end of that range, probably because of their higher intake of legumes and nuts. And I would also wager that users of the Nutrition GPA app, you've heard me mention this before on the podcast, that they would also probably tend toward the higher end of that range because the foods encouraged by that app include a lot of those foods that are higher in phytosterols. So you could always take an approach similar to the one that I recommend for calcium supplementation. Instead of taking the entire recommended amount as a supplement, you could use a supplement or a functional food product or some combination of those just to close the gap between the target and what your healthy diet already provides. And finally, because the cocoflavanols and the phytosterols work through different mechanisms, you could potentially take them both. But in the interests of getting the biggest bang for your buck and minimizing the number of supplements you're taking, I think I'd be inclined, if cholesterol is your primary concern, to see how far you can get with the phytosterols first. Now, of course, you'd want to run all of this past your doctor. Depending on your situation and your other risk factors, they may be willing to let you try a phytosterol supplement for a few months to see whether it's enough to get your levels into a safe range. But if, despite all your efforts with diet and lifestyle and maybe nutritional supplements, you do end up having to take a statin medication to control your cholesterol, I don't want you to feel like this is a personal or a moral failure. Sometimes our bodies just need a little help, especially as we get older. And even though we may prefer to be drug-free, the benefits of taking a medication may well outweigh the risks. And also, rest assured that even in that case, your efforts with diet and lifestyle were not wasted. You will likely get much better results and need less medication as a result of those efforts. Do you have a nutrition question you'd like me to answer? You can email it to me at nutrition@quickanddirtytips.com or leave it on the Nutrition Diva listener line at 443-961-6206, and you might hear your question featured in a future episode. And also, I wanted to let you know about a special program that I'm offering later this month. It's on overcoming stress and emotional eating. If this is something that you struggle with, believe me, you are not alone. It's one of the things that people most frequently ask for my help with. And right now, before we get into the holidays, it just seems like the perfect time. You can learn more about that at wayless.life/stress. That's wayless.life/stress. Nutrition Diva is a Quick and Dirty Tips podcast. It's audio engineered by Nathan Sems with script editing by Adam Cecil. Thanks also to Morgan Christensen, Holly Hutchings, Davina Tomlin, and our intern, Cameron Lacey. That's all for this episode. I'll see you next week. Remember to eat something good for me.